So we are in the process right now of validating the process. TestIowa is located at our state hygienic lab. I think TestUtah is located at a regional hospital. We decided to bring ours into the state hygienic lab through the University of Iowa. So we have the PCR testing in one area, and then we have the TestIowa in another one. So Dr. Pandella and his team is taking all precautions necessary through the validation process to make sure that we can assure Iowans that the results that we are getting are accurate and what they should be. In addition to that, Utah is testing right now. They've opened it up to anyone that wants to test. We're still keeping ours very narrow so that they are testing anybody that wants to have a test. Hopefully at some point we'll get there, but we are still in the validation process with the Iowa State Hygienic Lab and Dr. Pandella and his team.
So does that mean you're not sure that the tests are accurate? Because
No, we are, but we're going to validate that at the State Hygienic Lab. And there's a process that they go through. They're CLIA certified, so they have to make sure that they make the, that they hit the criteria, and we're in the process of doing that, and we'll be able to report that out once they're complete with the validation. So they'll be able to test both.
So it sounds like one of the concerns was that this test requires a higher amount of virus in a sample than what the CDC would recommend. So have you checked those things out to make sure that these tests are going to be compatible to what you might get if you were taking a test from some other
And they would have
vendor?
to be, because they were FDA approved, so they have gone through the process, or they wouldn't have been able to be opened up and utilized in Utah. So they have gone through the process. They'll continue to look at what some of the positivity questions are. In the meantime, as we're going through our validation process based on the requirements that are put in place so that we can assure Iowans that the tests that we are relaying to Iowans are accurate and providing the information that we expect.